And one thing that I have found, now that I've been doing research studies for about a year now in a doctoral program, I'm currently actually doing my DBA at Liberty University. I'll be switching over to the PhD at Limerick, God willing, as soon as they accept my research proposal there. But one thing that I was having trouble finding was research around when you have a really competent, high-performing project manager, and because of their competence, they kind of get stuck. They get pigeonholed, if you will, into perhaps a very long-term, seemingly never-ending project. So I thought, governance is a good thing. We've got a lot of information about governance, best practices, how to do strategic prioritization so that we can do good project selection. But one of the things when you do that well, it also kind of can, if you do it well again, mitigate the risk of being pigeonholed or getting stuck because you're such a successful project manager, especially in regulated industries. So this case study is actually a compilation of multiple similar kinds of projects that I've kind of compiled into a case study. In other words, I've removed names of individuals and made some slight changes for common situational details across multiple similar initiatives to protect the innocent and mitigate risks of potential future lawsuits. All right, so let's move on to the next. So before we really dive in, I really wanted to check in with the group here. If you would please use your smartphones, access that QR code, and in a word, why, or as our keynote said before, what are the reasons why projects may become never-ending? Why would you think that they would become never-ending? Scope change, absolutely. Creep, scope creep for sure. Yep, changing scope, we've got a theme here. Mm-hmm. People, changing needs, issues, ambiguity in requirements. That's a good one. Yes, absolutely. Missed requirements, for sure. Leadership. Yes, new employees. That's an interesting one, for sure. All right. Lack of documentation, resource availability, scope not defined up front. Excellent. These are exactly the reasons, the key reasons, and this matches up really with the research as well. Very poor decisions, absolutely, for sure. Yeah, all right. Well, thank you very much for engaging here. Anybody have any thoughts or questions here? All right, great. So navigating never-ending projects in highly regulated industries. As far as the research shows, this is a key area where projects may become seemingly never-ending. It's critical in these environments to have a good governance setup, to know how to strategically prioritize. And another third pillar that I felt was very, very important, and I believe the research supports it, is having strong emotional intelligence skills. High emotional intelligence. So our agenda today, we're going to be talking about what I call the competence trap. This is our IT healthcare case study, how excellence sometimes becomes captivity in regulated environments. Then we're going to talk about the background and the challenge specifically around this case study. It involves healthcare IT, a very large, multi-year, very complex program. It involves CMS mandates, which that's the Centers for Medicare and Medicaid. That's a regulatory agency. And scope without boundaries is what I was calling it. A nice way of saying scope creep that just keeps creeping. All right, and then we've got our 3-pillar solution, which is my recommendation: governance, prioritization, and emotional intelligence. We're going to correlate and map PMBOK 8 alignment how the 8th edition codifies these particular solutions. I thought that the PMBOK 8 was very well done. There's always room for improvement, of course, but I had the opportunity and the honor of actually being a draft review contributor for the 8th edition, so I love it, and I brought it as a prop today also. If you don't already have this, I highly recommend. We're going to talk about some specific outcomes and lessons learned from having implemented a very good, solid governance structure, a process for prioritization that's repeatable, and how emotional intelligence applied well helped not only with the best practices and the value and the outcomes that good governance and prioritization comes, but also the emotional intelligence, how that would help a project manager get unstuck. And then hopefully we'll have time for questions and discussion, but I like an engaging audience. So if you have questions or comments, ideas, suggestions, let's have the dialogue all throughout. I'm totally open to that. All right. And our next Mentimeter, I would like to know what industries do we have in the room? Because this will also help with the dialogue. This time I'm going to join you for this one. Remember to scroll down to the bottom and hit submit. All right, we've got a few healthcare folks. Financial services, wow, a lot of financial services in the room. Government, education, we have one other. Very good, I was hoping to get some other in here. Who's the other? What industry?
I'm in retail.
Retail.
I spent 20 years in healthcare.
Ah, very well, then you know. Yeah, very good. All right, any others? Do we have everybody? We'll give it another few seconds. All right, couple from education, great. Another healthcare, excellent. All right, financial services. Who do I have from financial services? All right, what company? Awesome, very good, welcome. And education? Where are you from?
Texas A&M system.
Excellent, very good, very good. And we have somebody else with an other. Who's the other? Yes? Sorry?
Trucking, transportation.
Trucking, transportation, excellent, very good. All right, I'm looking forward to having some dialogue here. Very good, thank you for participating. All right, so let's talk about the competence trap. If you are a competent, high-performing project manager, and hopefully you are, especially in regulated industries, you have heard you're too valuable to move, or you're probably going to hear you're too valuable to move. These are the sticky, political, crunchy project programs that really require somebody who gets to know the lay of the land, builds those relationships, they have high credibility, and they just hug you, they love you, they never ever want to let you go, they'll smother you. So take it as a compliment, it is a compliment, but in the long run, if you get passed over for that really super cool AI project or that promotion, it starts to feel more like a backhanded compliment.
Yeah.
I take it some people can relate. This is what I call the competence trap. It's a paradox. All right, so the background, the anatomy of a never-ending project. The initiative, we have an electronic claims attachments implementation in healthcare. So this has to do with the claims from the doctors or the hospitals that get sent to the health plan to be processed so that your claims get paid. And hopefully you don't owe so much to the doctor or the hospital. A lot of times these claims, based on the diagnosis or what's going on in the episode of care, they may require that certain attachments be sent with that claim to support that claim so that it gets processed and hopefully paid accurately and correctly. Even to this day, there are some providers that are sending these attachments via paper or their claims paper and sometimes over fax. The federal government wants that to go away. Most health plans want that to go away. So there's an initiative that's been going on for multiple years. It's called claims attachments. Many health plan organizations have projects around this. And this is the case where it became a never-ending program or initiative because the CMS rules kept changing. We kept getting more and more. So we've got payer adoption at inconsistent rates across the sphere, the whole industry, which also contributed to it being a moving target. And every time we would get a new guidance, it would trigger an assessment, which would trigger a gap analysis, which would trigger a change request, and on and on and on and on. So the scope boundary became permeable, delivery became a perpetual program, and this particular high-performing project manager who knew where everything was, where the bodies were buried, where the documents were, and who made what decision, etc. And that person became absolutely the critical, indispensable person. And at times could be a bottleneck as well. So a quote from my paper, and by the way, my paper and this presentation should be made available online by UT Dallas. Her ability to absorb ambiguity and keep the program progressing made her indispensable. This is the trap. Competency as captivity without governance, that is. So fun fact, wanted to share, as of March 20th, 2026, CMS came up with their final rule, CMS-0053-F. If you're interested, you can Google that. It'll tell you all about it. This particular new standards is due to be implemented by all health plans across the board by May 26, 2028. So some health plans are probably scrambling to plan this all out, get it done in time, and others are going, we did it, it's all done. Depending. According to Google AI, though, once everybody has implemented this, the new standards are designed to improve efficiency, reduce administrative burden, and accelerate claims processing with an estimated annual savings of $781 million for the healthcare industry. The stakeholders involved with this initiative, of course, are the healthcare providers, health plans and payers, the clearinghouses, which are external vendors that help, they're kind of the middleman with the claims processing. We've got other technology vendors, and of course, we've got the patients and the consumers. All right, the challenge, scope without boundaries. So the concept of healthy boundaries is a thing, not just at work, but across the board in your lives with other people. You got to have healthy boundaries. Even in complex project environments. And healthy boundaries cannot be healthy without also having clear accountability. Very, very important. So on the left, you've got your regulatory-driven scope creep. And on the right, we have stakeholder accountability gaps that have been identified for this initiative. Scope change arrives with the compliance authority. You cannot deprioritize a CMS final rule. The question shifts from should we do this to how quickly must we do this and what do we have to defer in order to be able to do this? You have decision drift. Urgency claims go unchallenged without transparent evaluation criteria. This happens, and it does happen, and it will happen. When you have a CMS final rule or some other regulatory rule, what have you, somebody comes up with an initiative that's associated with that rule. If you don't go through governance and do some fact checking, perhaps some myth busting, it goes unchallenged, and that scope creep could have been avoided. Every stakeholder believes their requirement is the highest priority. Then we've got stakeholder accountability gaps, multiple stakeholder ecosystem. We've got the state regulators, sometimes multiple state departments that don't necessarily speak to each other. We've got federal compliance, we've got IT, multiple vendors that perhaps are involved, and of course, the multitude of executives. We've got deadline slips. The root causes are attributed to others' domains. We got diffusion of ownership allows problems to persist longer than they should. And the PM is held accountable for outcomes but has no positional authority to enforce decisions. So this is the challenge. Oh, and down at the bottom, I've got the influence without authority. The influence without authority challenge. So we're responsible for results that depend on people and systems that you do not control. All right, so here's my 3-pillar solution. This is my recommendation. So over here, we've got the first pillar, which is governance. And I try to put it in simple terms from the PMBOK 8. Now, you can make this even bigger because the PMBOK 8 actually has multiple areas where this could intersect, map, and apply. But for the most part, we've got the recommended change control board, a CCB. You've got a structured intake, transparent criteria, decision audit trail, a cross-functional membership. This is critical. All those stakeholders that I just spoke about before, for this case, you need to have at least one representative from each of those groups on the board. And if the person with the purse strings is not one of those, they also need to be on the board. This reduces decision drift and scope overload. Then your middle pillar, we've got prioritization. This is strategic prioritization. This is based on the initiative. It needs to be very thoughtfully designed. But for the most part, this, from the PMBOK, this is the integrated tailoring framework that is a case by case. It's customized. But when you're in a regulated environment, this should work for the most part. You've got your tier 1, which is every mandatory intake item. This is your CMS rules. This is your FDA standards, your whatever regulatory agency that you're working with, this is mandatory. You have no choice. You have to implement this. Then you've got your tier 2. This is your enabling item. This may or may not be needed. It's associated with the mandatory rule. You have to assess. Then you've got your tier 3. This is a value add. Could be associated, but it may or may not be needed. Something like this could be your reporting dashboards. This matches capacity to the compliance obligation. And then your third pillar, you've got emotional intelligence. Now, there's multiple parts of the PMBOK 8 that you could apply here. But what I found is mostly this has to do with the lead accountably principle. I call it lead accountably. The principle is actually be an accountable leader. I like to say lead accountably because lead accountably to me, in this case, lead accountably. Lead accountably. It starts with a verb. Your power skills in practice. This is where you really have to have strong skills. This is the competent, high-performing project manager. They are self-aware. You have empathy. You have conflict navigation and influence without authority. This enables shared accountability. Your governed execution goes from reactive delivery to predictable, accountable program performance when it's done right. And by the way, this can be done iteratively. It may take some time to get everybody on board and following the standard process, and then iteratively, continuously improving the process, the intake, the form, the categories, the reasons, etc. But once you got it down, and so-and-so sacred cow project lever stops coming directly to the project manager and now starts in following the intake process, or assigning somebody to follow the intake process for their request, then you've got it. You've got it. All right, so again, the PMBOK 8, we've got our governance domain, lead accountably principle, or be an accountable leader principle. You've got your stakeholders domain, and then you've got your tailoring. Any questions or comments so far? All right, so pillar 1, governance. We've got our cross-functional membership for this case study. This involved compliance, clinical operations, IT, vendor management, multiple vendors, by the way, and governance, government programs leadership. So decisions reflect organizational breadth and not the loudest voice in the room. Standardized intake form. We have the requesters, they must document who the regulatory authority is, and by the way, they need to name the person associated with that regulatory authority. They can't just say CMS or FDA. They've got to say the name of the person who sent us that, or who we can contact for questions, what have you. Always got to have a name. It's got the compliance deadline, the technical impact. We have to have an impact assessment done before that intake form gets submitted, and the consequence of deferral. What happens if we don't do this? This reduces frivolous escalations, and I can't tell you when you do this right how many fun, fact-checking, myth-busting, yeah, that really wasn't a must-have, it was a nice-to-have, switcheroos. I can't tell you, you got it. This is so critical. And then you've got your multi-criteria scoring. There's 4 dimensions. You've got your compliance risk, your organizational readiness, your business value, and your dependency risk. When you identify the impact assessment or the dependencies, is there something that's dependent on this initiative, or is there something that this initiative is dependent on? You've got to have that dependency risk. And when you have your CCB meeting, your change control board meeting, they take into consideration everything that was put in that intake form, and they score each of those areas, the CCB, not the project manager. And over on the right side, I've got the little flow chart here that explains how that's done. Now I'll pause and see if there's any questions or comments.
Shauna, they're just a little small for my eyes. What are the scoring criteria? Please, can you show me?
We've got our compliance risk.
Okay.
Let's see if I can get this to work. Compliance risk, your organizational readiness. You've got your business value right here, and your dependency risk.
Okay.
There could be something that's dependent on this initiative, or other things that this initiative is dependent on. And based on who's attending, who's in the CCB participants, they'll know if there's a risk associated with, oh no, we need to get so-and-so involved because we can't do this without this being done, or, you know what, this kills this other project. If we have to do this other project that's in execution, they're gonna have to be full stop, depending. Yes?
Trying to formulate a question. For me, what's kind of blending here, and I'm curious on your thoughts around it. We have a new business intake forum, change control is centralized within the PMO. Is this something that you think that there should be synergies back to that original intake as well, and kind of balancing against the new to kind of marrying those forums?
Absolutely. Absolutely. If there's something that has been working well, but it can always be better, right? Always get the stakeholders involved to provide their inputs. You can propose, hey, this is great, but what if we made the improvement of doing this way? Thoughts. Get them to weigh in because, as you know, people support what they help to create. And sometimes I like to, in an emotionally intelligent way, ask leading questions and get them to suggest ideas that I already know and I was going to recommend it. But if they come up with the ideas like, oh, that's a great idea, let's do that. So another strategic approach. Does that answer your questions?
I just want to spend a minute to talk about this. I think this is really important, and I see shadows of it in my own organization. So we have an intake process that's more project management. And if it gets to intake, that means it's actually going to happen. So there isn't this rigorous review that it probably should have. And then we have a change control board, but it is solely focused on IT changes, systematic changes. That's it. And I've been trying to somehow marry the two or elevate us to a more strategic level, because what I find, we were talking about the switcheroos and stuff like that. My favorite is when we have 3 executives that all think they own the outcomes of a particular initiative, and each of them has a very different idea of what that's going to look like. That's my personal favorite. So I would love to somehow elevate us to that slightly more strategic level, but we are definitely in that success trap right now. It's like, you guys are really great at being project managers. You've handled some very large implementations. We love you, and we want you to stay right there, which is really bad for growth potential, morale, and all the things. So I'm trying to figure out, how, and I believe we have approached this so many different emotionally intelligent ways, right? Asking good questions, making presentations and recommendations, all of it.
Yeah.
And it's just this very small organization. So I get some of the pushback, but still, if there's a way I could somehow marry it and make it look like this, just think that they cannot ignore it, that would be amazing.
Yeah. So Stephen Covey is one of my heroes.
Yeah.
The 7 Habits. Absolutely. When I make recommendations, and I think I've hit all the right people, but I realize, what, my circle of influence needs to grow if I'm going to get any headway, or from an emotionally intelligent perspective, self-awareness.
Yeah.
Sometimes I realize, what, I've hit a plateau.
Yeah.
My circle of influence is not going to grow here.
Yeah.
Now it becomes perhaps a different decision.
Yeah.
If that helps.
I don't want to talk to you about that.
No problem. Anytime. All right. Very good. Very good. All right. Second pillar, your strategic prioritization model. Super important. Why traditional prioritization fails in regulated environments? Primarily, the standard frameworks based on business value or strategic alignment do not account for the non-negotiable compliance obligations. When a CMS final rule arrives, strategic initiatives must yield. Full stop. Period. So the power of this tiered model, you might have a conversation with your CCB, your sponsor, decision-making leadership, what have you. We can absorb this tier 1 requirement on schedule if we defer this other tier 2 item by 6 weeks. And here's the compliance risk of that deferral. So this transformed, in this case, resource negotiation from an emotional plea for more staff into a structured governance conversation about risk tolerance. And then we've got, of course, the tier 1, tier 2, tier 3, which I had previously talked about. I know this is small words, sorry about that. You should have access to the slides later. But the tier 1 example here is the CMS final rule with a compliance deadline. For tier 2, we've got the example of a gap remediation ahead of an upcoming audit. Audits will happen. If you have a regulatory implementation, especially a big program based on a CMS final rule, make sure that you have in scope for your program audit readiness after go live, because chances are inevitably you will be audited. And then the tier 3 example here we have is a reporting dashboard enhancement. Super cool, awesome. Not, depending on the money, who's involved, what's needed, may or may not fly. All right, so, and this is consistent with the PMBOK 8, of course, with the integrated tailoring framework, which embeds context-specific guidance within each performance domain. All right, before we go to the next one, this is what we call a force rank prioritization. I don't want you to spend too much time thinking about this. Just pick which one of these stands out the most as number 1, and then the next one that stands out the most, and then the next one, and then the next one, and then the next one until you get through all of them, and then hit submit. Very good. All right, we're seeing some trends up and down. It's great saying no. Absolutely. Very big tough one. Interesting. Staying calm was at the top before, and now it's towards the bottom. Interesting. All right, very good. Is anybody still working on this? It's like we're all done. All right, very good. Interesting. So saying no was the top one, top toughest, hardest for PMs under pressure is saying no, for sure. Then holding others accountable, especially when you don't have a governance structure that everybody's following, very difficult. Managing that, for sure. Then communicating the hard truth. Giving candid feedback. I know that's been a tough one for me. Staying calm has been one of the biggest factors why I like to study emotional intelligence. I want to be grace under fire. That's something I've always been so impressed by leaders who, even in the toughest, most high pressure situations, they remain calm, cool, and collected. They speak calmly, confidently. That's how I want to be. I don't always achieve it, but that's what I want to be. And then reading team morale. Anybody think of any other tough things for PMs under high pressure situations that I didn't list here? All right, very good. Thank you for participating. And if you didn't hit the submit button, make sure you scroll down and hit submit. All right. Now we've got our pillar 3, emotional intelligence. Now, one thing that I want to make a mention of first and foremost and give credit for is Daniel Goleman. In 1998, he wrote his emotional intelligence book. If you haven't already read it, I highly recommend it. He's got 5 components of emotional intelligence, and the first 3 have to do with self. You've got to put your own oxygen mask on first before anybody else on the plane. So the first 3, you've got self-awareness. Be aware of your emotions as they arise. Number 2, self-regulation, self-control. Manage your impulses, soothe yourself, and respond appropriately. Take a deep breath if you have to. And number 3, self-motivation. Delay gratification, stay motivated and persistent in face of setbacks. Staying optimistic is key, and getting in the flow of peak performance, even under high pressure situations. So those are the 5 from Daniel Goleman. Now, based on my research, my own research studies in my doctoral program, and my own experience as a practitioner scholar, I present to you 4 components of emotional intelligence as they relate to project management, especially in context with the PMBOK 8 lead accountably, or be an accountable leader principle. So self-awareness is critical. You've got to continuously monitor your own responses to sustained overload. Without self-regulation, withdrawals, cynicism, and defensiveness, communication, those kinds of communications or reactions, if you will, they undermine your credibility. Then you've got empathy. This is so critical. We do not have enough people having empathy. I believe this is a critical skill if you want to be a good, excellent, great, high-performing project manager, period. Or a leader, anyway, a leader. Empathy. Treat each stakeholder perspective as legitimate data about the organizational system. All of the stakeholders, honor them all. Even if you can't deliver what they want, honor it, document, let them know that you heard them, you understood them, and even if you couldn't get what they wanted, you documented it for the record. Especially if they're saying, hey, if we do this, we're at risk of this. I hear you, and I even agree with you, but the powers that be. So we're documenting it, and we're getting ready for the audit. That will probably show the risk that you stated that we all agree on is probably going to happen. We're ready for it. Conflict navigation. Surface accountability gaps in structured settings using data-driven framing. Data. Is there data? If there's no data, fact check it, myth bust it, get the data. Make it about systemic risk, not individual failure, and create shared ownership. It's not all about the project manager. And then we've got influence without authority. Now, I know the PMBOK really doesn't call this out specifically, but it is what it is. Influence without authority is a thing you need to be able to do. Be responsible for the results that depend on people you do not control. Build trust, demonstrate competence, earn the right to lead without a title. Be the proxy that the leader, the executive leader, the decision maker says, I'm not going to go to this, I want you to go to this, and you have my decision authority in that meeting. All right, I'm not going to go too deep into this. Again, you have.
I have a question.
Oh, yes.
Yeah, so on this one, it made me think of something that I think is maybe missing from the previous one. I think PMs often find it difficult to frame decisions effectively.
Mm-hmm.
And I think empathy, conflict navigation, and influencing without authority all really kind of dovetail into that. And I've seen so much success from PMs navigating through conflict and scope creep and just projects that are stalling when they're really kind of pulling all of those together and framing up those decisions. So that I think might be missing on these maybe.
Absolutely. No, that's a good call out. Thank you. Absolutely. We need to be able to communicate effectively. We need to be able to strategically present, hey, here's the issue, here's the risk, what have you. And here are your options for a decision. And this is my recommendation. You've got 3 options here. My recommendation is option 1. And here's why. And here's the data. Exactly. Very good. Good call out. Thank you for that. All right. So I'm not going to go too far into this. Again, you'll have access to the slide. The 8th edition, we've got our governance performance domain. Governance has its own domain. I love it. Then we've got our lead accountability principle. Again, that's be an accountable leader. Stakeholders performance domain and your tailoring framework. Now, there are more aspects that you can map in the PM BOK 8. I have found others, especially as I continue on to study this stuff. But for the most part, these are the 4 areas that I identified. And then here, from our case study, by implementing the governance, prioritization, and using strong emotional intelligence, we go from reactive delivery to governed execution, and a repeatable process that can be very effectively transitioned from the high-performing project manager to a new project manager, even perhaps a junior project manager that wants to be promoted into your position that you're mentoring. You should be mentoring them. Bring them on. They follow the process. All the documentation is there. It's something that they can manage now without you. Now, one thing I'm going to make sure that I'm very clear on, you're not going to get rid of urgency and you're not going to get rid of complexity, but you will mitigate the risk of everything being a priority, which means nothing is a priority. Hello, Sanity. Welcome back. I've missed you. All right, so measurable outcomes by doing this. Decision drift goes down, competing priorities adjudicated through a common framework, not escalation wars. Decision quality goes up, cross-functional change control board input made decisions more durable against stakeholder challenge, myth busting, fact checking. Is that really a must-have or a nice-to-have? Stakeholder accountability, the CCB participation required requesters to be present to justify the documentation and accept outcomes if they didn't get their way. Distributing ownership and not making the PM the bearer of bad news. Career mobility, this is the risk that I haven't found a lot of study research on, but establishing a really good governance, prioritization, intake process, and applying emotional intelligence equates to career mobility. So the PM could transition confidently, whether internally or externally. The system could function beyond her, and she left a very good legacy. And some really great, references along the way. Lessons learned for PM leaders in regulated environments. Governance is not bureaucracy, it's sustainability. Prioritization is a leadership act, not a technical exercise. Emotional intelligence is a core professional competency. It is. And indispensability is a risk that must be managed. I strongly recommend that it be managed. So I really want to emphasize number 4 here. My best advice is when you're really good at your job and you become the de facto go-to person for everything to do with this never-ending program that you lead. Do take it as a compliment, which is what it was meant as, but consider it to be a risk that needs to be mitigated. Don't find yourself stuck. Keep growing your career, upskilling and broadening your horizons to stay relevant in today's job market, especially in today's job market. So what does this mean to you if you've heard or perhaps will hear you're too valuable to move? So these are just some suggestions that I have here. Since we are running out of time and I got the yellow light, I'm gonna keep moving on. Again, you'll have access to these slides later. In conclusion, the 3 pillars, this is my recommendation. Build systems robust enough to function beyond themselves and combine rigorous structural discipline with the deeply human capacities that make sustained collaboration possible. And this is just my gift to you. I love AI. Just like our keynote speaker said earlier, I plugged my paper in and I was like, what kind of roadmap can I put together? And I was amazed. This was really cool. So you're welcome. All right, so now bonus. Here are some other regulated industries, some nuances for each one that I kind of brainstormed on and thought, these are interesting, just something to keep in mind. And I know we've got some other industries in here that I didn't call out, so I really want to ask for the other industries. What are some other nuances in terms of regulated initiatives that could be associated with your work? Yes.
Yeah, so I work for Sunlight Beauty, so I work partially with the private label company. So we create skincare formulas, hair care, shampoo over the counter. So it kind of goes a little bit along with maybe pharmaceuticals to some degree because there's ingredients.
Mm-hmm.
And so we have to have state regulations. And then we get, for all of our private label products, if we find out there's an ingredient that's no longer going to be supported, we have X amount of time to get that ingredient off the shelf.
Mm-hmm.
And then we have liability where if you don't sell the product, then you have to incur the cost to destroy it. So that's been really interesting. And so I know just thinking about this timeline is the regulations come down and then you're trying to quickly figure out your strategy and then reformulating with your vendors and getting the product with the new ingredients. So that's a big one to me.
Very good, very good. Oh, excellent example. This should actually work very well for that.
It was really exciting.
Awesome, very good. And I had somebody else with another transportation.
Yeah, so we have OSHA standards and then additional safety.
Very good. Similar to construction, OSHA. Yep, very good. All right. And here's our last mentee. Now that you've been here to day 2, you've had 2 keynotes, you've probably attended other sessions as well. What is now one thing that you will do differently going forward? It could have to do with today's session here, could have to do with the keynote this morning, yesterday. Just, I'm interested. What's one thing that you will do differently going forward? Don't be afraid to ask. Awesome, very good. Be more empathetic. Very good. Speak up and ask. Say no more frequently. Hopefully politically correct. Yes, always ask for what you want. Ask. Very good. Be bold. This is great. Align PM and OE. Very good. Update the intake form. Focus on operational excellence. Whoops. Sorry. Just scroll down. Okay. No, it's not gonna let me. Interesting. Well, I will be posting this with the slides later, so you'll be able to see everybody's answers. unfortunately, I don't know why it's not letting me scroll down. But thank you so much for your participation, everyone. I think some people are still doing, let me give it another minute. All right, very good. Yes.
Can you go back a couple slides to where you had that AI generated?
Yes, right there. Absolutely.
That's-
Thank you. Yeah, I was pretty amazed. I'm like, hey guys, sometimes, not all the time, but sometimes amazing.
Sean, did you run that slide when you put your paper in? Is that private AI or is that public AI?
I want to say it's private because,
So you're paying a subscription?
Yes.
Got it.
Yes.
Okay.
no problem. All right. So now we're to our questions and answers part. We've only got a few minutes left. I had some leading questions in case like it was crickets in the room, and it doesn't seem like this is a crickets room. So anybody have any questions? Yes.
So in our organization, we have people, project managers that are assigned to domains.
Mhm.
We have 16 domains. One of the benefits of that is that PM naturally gets closer to the team, they get closer to the domain, they understand the regulations, they understand the business, they understand the meeting, develop relationships with stakeholders.
Right.
How do you think, especially from an emotional intelligence perspective, you would approach project managers about being open to changing domains, especially if they feel with some of the more junior ones, or I haven't learned all of this one yet, I'm not comfortable to spread and grow, and I want to stay here and build on my success, but then that leads them into this trap of then getting stuck. So it's a little bit of a quandary.
Yeah. All you can do is sow the seed sometimes. You can lead a horse to water, type of thing. I would strongly encourage any organization to have a mentorship program. And even require, especially PMOs, have their PMs, especially those that are kind of new, or only been there for a year, to have mentors, or the older ones to be mentors, have mentorship. And then have check-ins, kind of lessons learned almost, or quick wins, celebration, what have you, in your PMO meetings. Hey, something to celebrate. So-and-so took a chance and took on this other project that was outside their comfort zone. Look how awesome they did. They've got this new skill, or, what have you, to celebrate, give kudos, accomplishments. But you're always going to have sometimes those people that just don't want to change and they refuse to change. And you have told them what the risk is to their career mobility. They don't want to listen. If the next restructure comes around and they haven't upskilled, they haven't put themselves out there, they haven't grown those diverse relationships outside of that particular bubble, you try. If they were good in that bubble and you could be a reference for them, you could say, hey, I'll write a reference for you, good luck. You find a great other job, but that's about all you can do. Does that help? Yes.
What advice can you give, or a couple of things you can say with regards to, how you said everything is a priority, which means nothing is a priority?
Yeah.
So what if leadership is just throwing tons of stuff at you and your PMs in a team? And that time and energy are not unlimited.
Right.
There's a certain amount of time and a certain amount of energy that we all have. So how do you communicate to them that your demand is, given the time and resources available, I cannot work on a million things at once.
Sure. So if your organization does not have a tool set up that helps you to resource level across your initiative, there are tools available on projectmanagement.com from PMI There's other, tools that you could find outside of that, but if you're a PMI member, which by the way, I hope everybody is a PMI member. If you're not, you're missing out big time. There's so much that you can get as a PMI member, including as a member, you can get the full digital version of the PMI. No additional charge. So I would research tools, and if you have access to AI, a lot of organizations are starting to implement AI within their organizations. Like I've used Copilot. I would plug information in, all of your project plans, all the data that the AI would need to assess and analyze. What are the risks? What resource needs do we have? If we do all of this, what something's going to give, and provide those scenarios based on the data and put some very compelling recommendations together with options. Here's the issue. Leaders, decision makers, here's the issue. Here are your options, and here's my recommendation. And then let them decide. And if they don't decide, if they say, you just have to do it all, just do it. You've done what you could. An emotionally intelligent person says, okay, I've tried. I've sowed the seed. I've documented. See what I did. If what you documented and very clearly told them what could happen and it ends up happening, you've done what you could.
What was that website again?
The website,
You mentioned a website.
projectmanagement.com,
Oh, project management.
or pmi.org as well. So, yeah. Sure. All right, I think we are at time. Thank you so much, everyone. Enjoy the rest of the conference.